All right, hello. How you doing today?
Hello, I'm good. How are you?
Good. My name is Alvin. I'm going to be your nurse for today.
Okay.
Okay.
Nice to meet you.
All right. And I'm going to do a hand hygiene prior to doing this test. All right. So can you please tell me your name and your date of birth and why I brought you in today?
Okay, my name is Ruthie Zor. My birthday is August 31st, 1983. I came in for a physical.
Okay. So exactly, I'm going to be doing a physical assessment on you today. It's called a head to toe assessment, which is just doing like an overall general assessment of your body. Okay. So the test is going to start from your hair all the way to your feet. Okay. All right. Do I have the permission to do this test now?
Yes.
All right. Thank you so much. So I'll be starting with your hair. Okay. Well, with your hair, do you have any history of hair trauma? Any
No.
concussion,
No.
any pain?
No.
Okay. So, all right. I'm just going to observe that. Is there any hair loss recently?
No.
Okay. So I'm looking at your hair and it's your hair that's on your scalp. I'm seeing there's no sign of hair loss. There's no lesion. There's no infestation like lice or pediculosis. Okay. And I'm going to be palpating as well for any lumps or bumps. Okay. All right. Hair is palpated and I didn't feel any lumps or bumps. And everything seems to be appropriate. Okay, scalp seems to be appropriate, and it matches your ethnicity and race as well. Okay. Next, we're going to move to your eyes. Do you have any history of eye problems?
No.
Okay. Do you wear glasses?
No.
Do you wear any contact lenses?
No.
Okay. All right. All right. I'm going to be doing a few tests for you. Okay, on your eyes. All right. I'm going to be assessing your pupils. Pupil is round and reactive to light. Okay. Uh, And I'm going to also be doing the sliding test, which will be studying your vision as well to see how you can see from a distance. So this like a 20 feet distance, we'll have the sliding chart up there. I just want you to identify those letters on the eighth line.
Okay, I can see line 8.
Close your eyes.
I'm going to start with my left eye. I see DEFPOTEC. And DEFPOTEC. DEFPOTEC.
All right. I'm going to also be assessing, you know, that's the 2020. So you currently have a 2020 vision upon passing that test. Okay. I'm also be going to be assessing your eye movement as well to assess for any abnormal eye movement like or strabismus or cross eyes. Okay. So it says cardinal location. Okay. Are you everything seems to be appropriate at this point. There's no sign of strabismus or any abnormal eye movement. Okay. I'm going to be assessing your nose. Do you have any issue with smell?
No.
Any loss of smell?
No.
Okay. Your nose, looking around it with assessment with my just inspecting it. There's no signs of lesion. There's no signs of cause of bruises. There's no excess secretion that I'm seeing at this point. I'm just going to check within your nose to see as well. Okay, I see a few hair in your nose, which is normal. It's there to like protect you from pollutants and allergens and just prevent us bacteria from going through, your nasal canal. Okay. All right. Next, I'm going to be assessing your mouth and your throat at the same time. All right. Looking at your lips, you have your mucous membrane. Do you have any issue with taste or your tasting? How your tasting
No.
look like?
No. Everything's been normal for me.
Okay, that's awesome. That's awesome. So your lips appear symmetrical. Okay, and I'll be assessing your mucous membrane as well. Okay. Upon assessing your mucous membrane, the mucous membrane look moist and tight. Now also assess your tongue. There's no touch. There's no sign of infection, even in your throat as well. Everything seems to be appropriate. Okay. Next, do you have problem with swallowing? Any issue with dysphagia? Okay, so no dysphagia, no problem with swallowing. Okay, as I also checked down there is no sign of infection down there as well. Okay. Next, I'm going to be assessing your ears. Okay, for my inspection of your ear. Okay, there is no sign of uh, lesion. There's no cuts. There's no bruises. I don't see any kind of bleeding. I don't see any kind of secretion coming out. So that's a good sign. And next, I'm going to just be checking your nose to see if there's any excess accumulation of wax. Okay. All right. There's no excess accumulation of wax in your ears because sometimes with these things, we can, have some issue with your hearing, your hearing. So we want to make sure that you don't have excess production of wax. Do you use any hearing aids? No. Okay, good. All right, I'm going to be doing something called a whisper test. All right, and I'm going to be doing it on the right side first. I want you to pronounce or say the words loudly when I whisper them. E. B, C, A, 1, 4, 5. Good. So with the assessment done during the whisper test, you pronounce all the words and the letters correctly. So I have no problem with thinking that you have any hearing problem at this point. Okay. Now we'll move to your throat. I mean, yes, we'll move to your neck. All right. I will just assess first during my inspection. There's no physical trauma. There's no bruises or lesion or anything like that on your neck. And next, I'm going to just be assessing to find to assess your thyroid glands. Now, I want you to swallow while I assess. Swallow. Swallow. Okay. So, upon assessing your thyroid gland and you were doing the swallowing as well, I felt it. They are palpable. There's no issue with this. All right. I'll move down now to your integumentary system or your skin. Have you had any history of skin cancer, skin diseases, or anything? No. Okay. All right. So at this moment, I'm just going to observe on the skin. Okay. Skin. All right. Okay. So there's no issue. There's no observable or apparent sign of bruising, jaundice, cyanosis, or any other skin disorder. No, or skin cancer, or any apparent sign of skin disease. Okay. So I would just advise that you keep doing what you're doing, but make sure every time you're going out, you use a SPF or skin or sun protection so that you can prevent sunburns and potential cancers. Okay. Yes. All right. Next, we're going to move now to your cardiovascular system. Do you have any history of heart disease? No. Any family history of heart disease? No. Okay. Have you been having any leg swelling or any No. abnormal heartbeat? No. Okay. So I'm going to be listening to your heart sounds. Okay. Okay. I'm going to be listening to your heart sounds. I'm going to be listening to 5 areas: the aortic, the pulmonic, the L-sprint, and the tricuspid and the mitral. Okay. Okay. All right. Upon auscultating your heart, there is no abnormal sound that was heard. I heard S1 and S2, which are normal heart sounds. They loved up. They were very loud and clear on assessment. So there's no issue with there's no apparent issues with your heart at this point. It seems to be appropriate. Okay. All right. I'm going to be palpating your pulses. So I'm going to be checking 3 of your pulses. You got multiple pulses, but we're just going to be doing 3 of them. Okay. which will be the radial, the pedal, and the carotid pulses. All right. So the carotid pulses, you want to do them one at a time because you don't want to make your patient to faint while you obstruct blood flow to the brain. Okay. All right. Pedal pulses. Okay. All pulses seems to be appropriate. Okay. And upon assessment, I can grade them as 2+ for each of the three pulses that were checked: radial, the carotid, and the pedal pulses, which are appropriate for your age and for your health status at this point. Okay. Next, we'll move to your abdomen. All right. And I want you to please lie down. Okay, upon assessment of my patient abdomen, there is no sign of bruises. There's no sign of wounds. There is no wound on her stomach, no stoma. Um, there is no lumps or bumps that are apparent at this point. So with inspection, there's no issue with her abdomen, or they are appropriate with all condition and race at this point. Next, I'm going to be auscultating before palpating because I don't want to disrupt the stomach sound or the bowel sounds. So I'm going to palpate. I mean, auscultate. Sorry. Bowel sounds are active in all four quadrants. And next, I'll be doing palpation or auscultation. And the auscultation is appropriate as well. Next, I'm going to be checking by auscultating the bowels, the abdomen, or any lumps or bumps. Any tenderness? Are you feeling any pain or tenderness? No. Okay. All right. No pain or tenderness felt uh, by the patient and myself. I didn't feel any lumps or bumps while I was assessing the abdomen as well. Okay. Now I'm going to be doing few tests as well for any other GI conditions. Have you had any GI surgery? No. Or GI surgery? No. Any constipation? Any constipation? No. Okay, no constipation, no GI issues. Uh, what I would advise is just make sure you continue to drink enough water. Yes. Yeah. Drink enough water daily, and make sure you eat a good source of fiber food to prevent any constipation or GI issues. Okay. All right. So I'm going to be doing an up the radar test, which I will raise this leg at the right time and go within a cycler position. Are you having any pain? No. All right. Patient has no pain. If there was a pain, then this would be indicative of appendicitis. All right. I will also flex the right leg as well. Any pain? No. Okay. This is the iliosoma test. If there was pain failure as well, that would be a sign of appendicitis as well. Now I want you to please sit up. I'm going to be doing the Murphy sign test. Taking deep breath, and I'll palpate your subcostal space. Taking deep breath. Any pain? No. Any pain? No. Okay, patient has no pain at this moment. If pain was felt, that would be an indication of cholecystitis or inflammation of the gallbladder. All right. Next, I would like you to please just scoop and turn a little bit to the camera so that I can check for the costal vertebral test. So the costal vertebral test, we do it by feeling at the mid back. All right. Any pain for any kidney issues? Any pain? No. Any pain in this movement? No. Okay. So the patient is having no pain, which is a good indication that the patient does not have any issue of that's related to the kidney at this point. So the three tests that were just done are appropriate. All right. Next, we're gonna move down onto the musculoskeletal system. Okay. Okay. We're gonna move on to the musculoskeletal system. So how is it working? Fine. Have you had falls? Any recent falls? No. Any broken bones? No. Any surgery related to your bones, your joints? Any hip surgery? No. Okay, so patient has no history of surgery, no falls or anything of such. So we'll also continue to do additional musculoskeletal tests to just establish a baseline for the patient while she's here. Okay. I'm gonna do the strength test and then the kinesthetic as well. So can you please stand for me? All right. So with the strength test, I would like you to push down. Okay. And then, and I'm gonna, all right, push down, push down. All right. And then, okay. Can you please sit? And I will test the legs. So this one we're doing the leg strength. Lay them all the way. Okay. So we're doing the leg strength. At this point, we're doing the leg strength. Lift your leg one at a time. Okay. Pull down on my hand. Okay. Push up. Okay. Lift the other one. Push down. Okay. Pull up. Okay. Okay. With the musculoskeletal test, additionally, we'll also do adduction, inversion. So I'm going to do the inversion and eversion on the ankles. There's no sign of eversion or there's no sign of eversion. Leg look appropriate, ankle look appropriate. All right, can you please stand for me? Adoption, okay, adopt, and then extend, and then flex. Can you flex your arm? Okay. All right, go ahead and sit. Have you experienced any joint swelling, joint pains, inflammation lately? No. Okay. All right. Next, we'll move on to the neurovascular system. Have you had any uh, nerve pains? No. Have you had any um, tingly numbness? No. At any point? No. Okay. All right. So, what? Can you tell me the date? Date is December 10th, 2023. Can you tell me your full name? Ruthie Zor. What brought you in today? The physical health assessment. And who's the president of the United States? Joe Biden. Okay. With this assessment, the patient neural test is appropriate. She was able to identify place, time, situation, and everything like that. And what appropriate she was supposed to identify with that test. She just listed them. Okay. We'll move on to the sterenosis test. The sterenosis test is done by you telling me objects, closing your eyes, and I'll give you objects, and you identify those objects for me. Okay? Can you please close your eyes for me? Sure. Okay. What did I give you? A cell phone. Okay. What did I just give you? A pen. Okay. What did I just give you? Your hand with a glove. Okay. All right. So you can now open your eyes. The patient has successfully identified all those objects that I gave her for this sternosis test. The next test we're going to do is the we it's called the next test we're going to do for now is called the graphis graphesthesia test. Okay, graphesthesia test. Sorry for the pronunciation, but the graphesthesia test. Graphesthesia test is where you're going to close your eyes, and then I'm going to draw some stuff on your skin. Okay, and then you will let me know what to wear. Okay, how's that?
A 3,
Okay, how's that?
0,
How's that?
8,
Okay, all right. Patient has successfully also open your eyes. Patient has successfully identified objects that are grabbed on her arm successfully. So she has passed the graphesthesia test as well. So I would like you to stand and then we can do the rumba test. The rumba test, you will close your eyes.
okay.
Okay, stand straight. All right, all right. You can sit back down. Patient successfully passed the rumba test, stood up, closed her eyes, and there was no swaying or uh, any abnormalities that was seen with her doing the rumba test. Next, we'll do the filling and the thinner test. Okay. So the thinner test, you stretch your arm, and I'm going to be close your arm, close your hand, right? And I'm going to tap from here to your elbow. Any tingling at all?
No,
Any tingling?
no,
Okay. So this is the thinner test. Patient stretch the arm and are able to knock the arm from the beginning to airborne, and there was no sign of tingling or numbness. Okay, so if there was a tingling or numbness with this test, then it will be indicative of carpal tunnel syndrome. Can you please stand up for me? The floating test. So you put your two hands together and bring it up. Any tingling?
no,
Any numbness
no,
in your fingers?
no.
Okay, so the patient have done the fitting test as well successfully. There's no tingling, there's no numbness with the test that she just demonstrated, no abnormalities that was seen. So patient has successfully also passed that neuro check as well. Okay, have a seat. All right, so this is how we come to the end of this physical assessment for Mrs. Zor. It was a nice time having you today as my client.
Thank you.
And I hope to see you next time to serve it again.
All right.
Thank you
Have
so
a
much.
good
Have
evening.
a great day.
So.